One of the updates, certainly we just this morning daily are releasing the number of new cases that are identified. We reported 11 new cases for this morning. This included one individual in their teens, one female in her 20s, one male and one female in their 30s, one male in his 40s, 3 males and 2 females in their 50s, and 1 male in his 70s. So this brings a total of 39 that we have tested positive in Dallas County. Our number on the website of Dallas County residents is actually 35 because 4 were out of county. Earlier this morning, 3 of the patients were hospitalized, including 1 in an intensive care unit. 8 are self-isolating at residences. 7 are residents of the city of Dallas. 1's a resident of Capel. 1's a resident of Irving. 1's a resident of Richardson, and 1 is a resident of Mesquite. We did have 5 of the cases where there was no source or travel risk factor, and so are indicative of community transmission, which brings our total to about 12 cases in Dallas County that have been identified as probable local transmission. One thing that's new, and I recommend everyone to go to our website, Dallas County Health and Human Services, the State Health Department website. CDC has up-to-date guidance, continually updated, but addresses multiple situations. One of the things that was now just came out yesterday, it's their disposition of non-hospitalized patients with COVID-19. And so these are using, if someone has COVID-19, even if they haven't been confirmed diagnosis by testing, it now gives some guidance of when someone who's ill and who's been staying at home with their illness, when they can safely be considered that the illness is resolved and they won't transmit it anymore. And so these are based on time since illness onset and time since recovery. So that definition, they're saying if 3 days since recovery, which is defined as resolution of fever without any fever reducing medications, and improvement in symptoms, respiratory symptoms. So 3 days after that, so resolution of the fever and improvement of the symptoms, then someone can be considered as recovered. And at least 7 days have passed since the onset of any of the symptoms. So now that gives us new guidance for people who, if they developed illness, but even if it hasn't been confirmed as COVID-19, that if they've been staying home and protecting themselves, then when we feel, and CDC recommends and has identified, that person can safely go back into the community and not spread it. So that's really an important development.